Hi viewers, welcome back. In today's video, we are going to talk about tetanus neonatorum. Okay, so tetanus, we would have heard this term. Tetanus is the like a type of fits where you will have that muscular movements and that type of symptoms there will be. Okay, so tetanus neonatorum is the condition which is affecting the newborn baby. Okay, so tetanus neonatorum, the causative organism is Clostridium tetani. So usually the portal of entry is through the umbilical cord. See, actually Clostridium tetani is the infectious organism. To prevent from this infection only we are giving 2 doses of TT during pregnancy. Okay, so when the mother is vaccinated, most probably you will not get the disease unless and until the exposure of the organism is very strong. Okay, so the portal of entry is your umbilical cord where the baby will get the infection from the cord and it will start spreading. So already in the previous class we have discussed about the omphalitis where the entry of your Clostridium tetani is in the umbilical cord. So when this is getting infected, complication, it can lead to toxemia. So one of the other complication is also your tetanus neonatorum where the infection will cause tetani to the child. Okay, so which will cause stiffening of the muscles and the baby will most probably the baby will die. Okay, so this type of severe infection, usually the incubation period is from 5 to 15 days after the birth of the baby. Okay, so this is with your intro and your prevention aspect. So as I said, prevention of Clostridium tetani is very easy. Get immunized to vaccines, you have to get immunized during pregnancy. Maintain a clean environment with the baby. Cover the baby with a clean towel. See to that the mother is clean and tidy when she is holding the baby, feeding the baby. She has to be very clean and tidy. So tetanus in pregnancy, TT in pregnancy you have to give, and 1500 international unit in case if you suspect it, like after birth you have to give international units of TT, immunoglobulins you have to administer. Okay, so that is like after the birth. So now comes the curative part or the treatment part. So the child is presenting with tetanus neonatorum and how do you treat the baby? Okay, see, now the baby is presenting with the symptom, the baby has acquired the infection and the risk has been like updated. So now the risk is very high. So treatment, like most probably the baby will die. So but when you are starting treatment only, don't think like that. So you will be trying from all the aspects. Okay, in most of the condition, prevention is always better. Okay, you have to remember the word prevention is better than cure. So which is very applicable here. Okay, so thinking of the small baby, you have to isolate the baby first. So okay, already the infection is severe, small baby, so isolate the baby separately so that the infection, the baby doesn't carry some other infection. And then tetanus immunoglobulin, that is 6000 international units you have to administer intramuscularly. So once your diagnosis is confirmed, and then you can give anti-serum, that is your anti-tetanus serum you have to administer. The dosage will be around 50,000 to 1 lakh international unit, either IM or IV you have to give. So in 12 hours duration, so that is like your BD dose you have to administer and the maintenance dose has to be followed. So antibiotics you have to start. So highly stable antibiotics where you have to treat systemic infection, very strong antibiotics you have to give it to the baby. So some doctors prefer penicillin, but nowadays like penicillin is like many doctors they don't prefer penicillin. So accordingly with the doctor's suggestion, the hospital's policies, you have to start with high dose of antibiotics. And then intubation. So like I said, no, body will become stiff. Similarly your respiratory muscles also will go under spasm. when there is a severe respiratory spasm, the baby will not breathe, so you have to go in for a ET intubation. So endotracheal intubation you have to do with artificial ventilation. So with ventilator you have to connect the ET tube also. And then nutrition by intragastric feeding, you have to start artificial feeding for the baby. Okay, so this is all your complicated things where you have to be very careful in the preventive aspect. So now we have discussed the causes, the prevention of the neonatorum, tetanus neonatorum, the curative treatment part. So coming to the prognosis part, the mortality is going to be 60 to 80%, the baby will die. Only 20% you can make the baby survive. So always remember prevention by your 2 doses of TT. Okay, hope you understand the class. In case if you have any doubts, kindly give your comments in the comment box. So until we meet in the next video, take care, bye.